Hello, I'm Dr. James, a physician specializing in longevity and brain health. Have you noticed your memory isn't quite what it used to be? Perhaps a word is on the tip of your tongue, then vanishes, or you walk into a room and forget why you entered. If these experiences are becoming more frequent, especially if you're over 60, please listen carefully to what I'm about to share. Your brain might be quietly weakening, and you may not even realize it. The surprising truth is that the cause could be remarkably simple: a deficiency in one vital vitamin. After the age of 60, there's a specific nutrient that becomes as crucial for your brain as oxygen is for your cells. I'm referring to vitamin B12, an essential nutrient for mental energy, sharp memory, and emotional balance. Recent research indicates that almost half of all older adults are deficient in this vitamin without even knowing it. This means millions of people are aging with a hungry brain, struggling with forgetfulness, mental confusion, and intellectual fatigue, unaware that a simple nutritional gap might be the root cause. Today, I'll explain why this happens, what silent symptoms to look out for, and how you can naturally and safely restore your brain's clarity and vitality in just a few weeks. So, why does this occur? As we age, our bodies undergo profound changes, and one of these directly impacts the brain's ability to function optimally. After 60, the stomach begins to produce less hydrochloric acid and a protein called intrinsic factor, both of which are crucial for absorbing vitamin B12. Unbeknownst to you, your body starts to function like a car with a leaky fuel tank. You put in the fuel, but the energy just doesn't reach the engine. The same thing happens with vitamin B12. It enters your body, but it isn't properly absorbed. This means you could be eating a perfectly healthy diet, consuming meat, eggs, fish, or dairy products, and still suffer from a deficiency. What's most concerning is that this deficiency doesn't manifest immediately. Instead, it slowly erodes your memory, mood, and vital energy. The situation is compounded by the fact that many doctors don't routinely check B12 levels in older patients as part of standard checkups. When someone starts forgetting names, mixing up times, or feeling mentally foggy, the diagnosis is almost always attributed to natural aging, even though the brain might simply be signaling a lack of vitamin B12. Let me tell you about a case I'll never forget. One of my patients, a 72-year-old retired engineer, noticed he was forgetting simple words, mixing up names of objects, and constantly feeling exhausted. Even after a good night's sleep, his family worried about the onset of dementia, but when we ran blood tests, his B12 level was 3 times lower than normal. A few weeks after starting supplementation, he came to his appointment with shining eyes and told me, "Doctor, I feel like my brain has woken up again." I see this kind of transformation repeatedly in patients with B12 deficiency. Most importantly, it's one of the most easily correctable causes of mental fogginess, if caught in time. Now, you need to learn about the quiet signals your brain might be sending. Vitamin B12 deficiency is insidious. It doesn't appear suddenly or cause acute pain. It develops gradually, almost imperceptibly. By the time symptoms become noticeable, they often mislead even experienced physicians. The first signs are typically very subtle: minor memory lapses, difficulty concentrating, slight confusion, or a feeling of brain fog. But over time, more pronounced symptoms emerge: mood swings, irritability, unexplained sadness, and persistent fatigue even after sufficient rest. Many patients describe it as if their mind has lost its brightness. Other patients report tingling in their hands and feet, loss of balance, or dizziness. These are symptoms often attributed to aging, yet they actually point to the nervous system suffering from a lack of vitamin B12. What's most serious is that this deficiency can mimic dementia, such as Alzheimer's disease. I've encountered numerous patients diagnosed with progressive cognitive decline, who, in reality, simply had critically low B12 levels. When we addressed the deficiency, the improvement was so remarkable, it seemed miraculous. Yet, it's not a miracle. It's just normal physiology. Once the brain receives the proper nourishment again, mental clarity returns with surprising speed. Therefore, if you or your loved ones experience 2 or more of these symptoms, it's crucial to ask your doctor for a specific vitamin B12 test. Not all standard checkups include this indicator. It needs to be requested separately. Many elderly individuals suffer for years, believing they are simply aging, when in fact, their body is lacking just one vital substance. So, why is vitamin B12 so vital for the brain? Vitamin B12 is one of the most powerful, yet simultaneously most underestimated, substances when it comes to nervous system health. It's a so-called neuroprotective vitamin because it directly supports the integrity of neurons and ensures proper communication between them. Within the brain and spinal cord, nerves are covered by a thin sheath called the myelin sheath. This structure acts like the insulation on an electrical wire, protecting the nerve and allowing impulses to transmit quickly and accurately. Without myelin, brain signals become slow, scrambled, and unstable, and it is vitamin B12 that keeps this sheath intact and healthy. But vitamin B12's role doesn't stop there. It's also essential for the production of neurotransmitters, the chemical messengers responsible for mood, memory, and concentration. With a B12 deficiency, the brain produces less serotonin, dopamine, and acetylcholine, which can lead to depression, irritability, and a loss of mental clarity. Furthermore, vitamin B12 actively participates in DNA and RNA synthesis, processes vital for cell regeneration, including brain cells. When the body doesn't receive enough of this vitamin, the brain literally ages faster. Studies from Oxford University have shown that maintaining normal B12 levels can reduce age-related brain atrophy by up to 30%. In other words, a single vitamin can help preserve brain volume and functionality for much longer. That's why I often say, if oxygen keeps the brain alive, then vitamin B12 keeps it awake. Without it, thinking slows, memory fails, and mental energy fades, quietly, day by day. Now let's explore the sources of vitamin B12 and the common mistakes that accelerate brain aging. Few people realize this, but there are only a handful of truly effective sources of vitamin B12, and almost all are animal-derived. Among them, beef liver is the undisputed leader in concentration of this nutrient. Following closely are oysters, sardines, tuna, wild salmon, and lean red meat. In smaller amounts, vitamin B12 is found in eggs, milk, natural yogurt, and fresh cheeses like cottage cheese or ricotta. The problem is that many older adults drastically reduce their intake of animal protein. Some do so due to chewing difficulties, others out of fear of cholesterol, and many because they follow outdated recommendations or modern diets that exclude precisely the foods that nourish the brain. Furthermore, in old age, complete meals are often replaced by processed foods, instant soups, and commercially produced cookies, which contain virtually no vitamin B12. Over time, this combination leads to a chronic deficiency, even in those who believe they are eating correctly. But there's also another, more alarming factor. Some medications directly interfere with B12 absorption. Drugs used for diabetes, such as metformin, and also reflux and gastritis medications like proton pump inhibitors, partially block the absorption of this vitamin. The longer someone takes them, especially for more than 2 years, the higher the risk of severe deficiency. I have observed patients who took these medications daily, complaining of constant fatigue, mental confusion, and unexplained sadness. Only a blood test revealed the true cause. Once we addressed the deficiency, their mood improved, energy returned, and their eyes sparkled once more. The brain is an organ constantly in need of energy, and vitamin B12 is one of the most crucial ingredients for this mental energy. Now, let's look at how to properly replenish your vitamin B12. Once a deficiency is confirmed, it's crucial to understand that not all supplement forms are equal. The most effective form of vitamin B12 is methylcobalamin, not cyanocobalamin, which is a cheaper and more common version found in pharmacies. Methylcobalamin is already in its active form. The brain recognizes and uses it immediately, without needing chemical transformations. This is why it's highly recommended for people over 60, whose metabolism no longer performs this conversion process with the same efficiency. The ideal dosage should be determined individually, taking into account blood vitamin levels and clinical symptoms. In cases of severe deficiency, it's often necessary to start with high doses or injectable forms to ensure absorption, even when the digestive system is impaired. Following this initial phase, treatment continues with oral forms, usually showing noticeable results within just a few weeks. I've repeatedly observed in my patients that after 3 to 4 weeks of proper therapy, clear signs of recovery emerge. The mind begins to work clearly again, mood stabilizes, mental energy increases, and the brain fog disappears. Many even report that their sleep becomes deeper and more restorative, something they hadn't achieved before. It's important to remember that despite being a vitamin, B12 intake should be supervised by a specialist. It can interact with medications and certain conditions, and everyone's body reacts individually. But one thing is certain: when the brain once again receives everything it needs, it recovers with astonishing speed. This is truly one of the most inspiring moments in medical practice, seeing a patient regain mental clarity, joy, and self-confidence. Beyond proper supplementation, there are simple strategies to help maintain B12 levels naturally. First, reevaluate your diet. If you eat meat, include beef liver at least once a week. A small 30-gram portion provides more than double the daily recommended intake of this vitamin. Fatty fish like sardines, tuna, and wild salmon are also excellent sources and offer an additional benefit: omega-3 fatty acids, which work with B12 to help restore neurons. For those who don't eat red meat, eggs and dairy products are important alternatives, though they contain smaller amounts. For vegetarians and vegans, supplementation becomes absolutely essential, as reliable plant-based sources of B12 are virtually non-existent. But what truly changes everything is the habit of checking your vitamin levels. Most people only discover a B12 deficiency after years of hidden symptoms. Therefore, if you are over 60 and experiencing forgetfulness, apathy, or mental confusion, be sure to ask your doctor for a vitamin B12 test. This simple step can be a turning point between accelerated aging and many years of clear thinking. Remember, the brain makes up only 2% of your body weight, yet it consumes about 20% of all the energy and nutrients you receive. This vital organ needs our constant care, and sadly, it's often the one we overlook. Therefore, I urge you to share this knowledge. Perhaps someone close to you, a parent, a friend, a colleague, is quietly struggling with forgetfulness or mental fatigue. They might not realize that the solution could be as simple as addressing a vitamin deficiency, offering them a real chance to regain clarity, vital energy, and the joy of life. Your brain can certainly age, but it doesn't have to suffer from illness or severe decline. Take care of your brain today, and it will take care of you for a lifetime.